Hello and welcome to the La+Jolla+Cosmetic podcast. I'm your hostess, Monique Ramsey, and today I have a guest who is very special and pretty new to our team, Dr. Diana Breister, and she's one of our plastic surgeons here at our La+Jolla+Cosmetic Surgery Center. So welcome, Dr. Breister.
Good morning. Thank you for having me today.
You're welcome. We're excited to get this done because you came in, did you come in March or February?
February,
but it's April now and you've been so busy. We haven't had time to do this little interview. So I'm glad that we're finally making the time for it. So you're the newest surgeon on staff, but you've been a plastic surgeon for quite a while. So tell us a little bit about, your background.
Well, I did my training at USC in Los Angeles and for about a year. After that, I was on staff at the City of Hope, which is a primarily oncologic hospital. So I did quite a bit of reconstructive surgery. And a year later, I moved to San Diego, where I started my own practice, which was about 20 years ago. And I've been in private practice, plastic surgery for the last basically 20 years.
Wow. So I love the shared USC connection.
Yeah.
and Dr. Riedler's in there too, which is kind of fun. So in terms of why you decided to come to La+Jolla+Cosmetic, what was kind of the thought that brought you into the group?
Well, as a private practice plastic surgeon, you really are kind of on your own. And after, 20 years of pretty much doing everything, just all by myself, kind of, it's rewarding in a way, but it can be tremendously stressful. And I had always known of the reputation of the La+Jolla+Cosmetic Surgery Center. I had always heard of it. There's not a lot of group practices in plastic surgery, so that clearly was one that always stood out. And they approached me and they said, "Hey, what do you think about possibly coming to join our team?" And I really had not considered that, as an option. But once that option was presented, I was very intrigued with it. And mainly the fact that there's a whole team of doctors and there's a very collegial relationship. And I was just kind of intrigued by the atmosphere of, a group of other doctors that we can all learn from and refer each other, refer patients, ask advice. And it's really been great so far. I really have loved that camaraderie.
Yeah, it's neat to, over the years, see our surgeons sort of collaborate on things, or even just so you could go out of town and have vacation and know that your patients are covered by the same nursing staff and other surgeons that you trust. I think that's always a nice little.
It's a nice level of comfort. Absolutely. Yeah, that's part of it too. But yeah, there's a great group of people, mainly, they're all really, really great surgeons and just wonderful people to, be around day in and day out.
That's nice. So you have an incredible team of people that you work with every day, then you brought along with you to our team. So tell us a little bit about your team that you've brought.
So I have Anna, who has been with me for about 5 to 7 years now, and she is part of the front office staff. She always, made the appointments and facilitated the patients coming in, and she's come along with me, and she's just a very lovely, sweet, amazing person who I'm just blessed that she came along. She recently had a baby, so I'm even more thrilled that she decided to stay working, which, that can always be a challenge. And then I have Estella, who's my patient coordinator, who is just a real dynamo. She's extremely fun, very relatable, very high energy. I think one of her best qualities is she just has this incredible ability to make patients feel very comfortable. She has a lot of, personal experience with plastic surgery in her family and she's from Costa Rica, where, in some of those other countries, plastic surgery is very popular. A lot of, people do that. And she just has this real passion for plastic surgery, which is exciting. And it always helps people to, be excited about it. She has this real ability. And she also has a real ability to make women feel empowered by it. They shouldn't feel guilty about it. They should feel like it's part of their self-care. So she's really a great patient coordinator.
I think it's always hard, any of us who come into a new organization, and especially one that's as big as La+Jolla+Cosmetic is, because we've grown, and having 6 plastic surgeons means a lot of support staff. And they've just, blended in and become part of the family so quickly. And it's so neat to hear, other employees talking about how great they are. And that's just, to me, that's a testament to you, because good people stick with good people, right?
Yeah.
So
it's always great when I hear people saying, "Oh my gosh, we love Anna and Estella so much." And I just feel so blessed that yes, they could come, and they did come, and they're here with me. It's very, very, it helped really with the continuity and just, and they're just they're a huge addition. Yeah.
Yeah. So tell us a little bit about the procedures that you love to do. I know you do pretty much everything, but what are kind of your passion projects, I guess, or procedures?
Yeah, well, I would say that there's quite a few of those. There's not just one. It's a hard question because people say, "What do you specialize in?" And I specialize in quite a few things. I would kind of break it down into, face, breast, body, and in those categories, as far as face, I really have, I think, perfected a really wonderful facelift that I call it a lower-end facelift. It doesn't have a fancy name. There's a lot of different vertical lift, this lift, that lift. A lot of doctors try to find a fancy name, but it's a lower face and neck lift. But the great part about it, and what I think achieve, is that I can do it pretty quickly, in that it's not gonna, you're not gonna be in the operating room for hours upon hours, which is nice. And you're gonna come out with a very, very natural look, but also a result, not just something that, you can see for a couple months. It's gonna last. It's gonna, really tighten up that jowl and neck. So that is really something I do love to do. I love to do the faces, and, I can combine those with the upper eyelids, or a fat transfer, or an upper lip lift, which is becoming very popular now, which really rejuvenates a woman's upper lip and really gives them a more youthful look. So that is something I absolutely love.
And do you call that a lip lift, or what do you call
lip lift? Yep,
a lip
exactly.
Lift? Okay. And so yeah, please explain what that is.
Yeah, so we make an incision essentially right, hidden under the creases of the nose and nostril. And depending on how long the woman's lip is, basically from the bottom of her nose to the upper lip, we remove some millimeters of that upper lip, and it basically pulls up the upper lip so that it can curl up a little bit more and provide a little tooth show. So, some people just, their upper lip is so long, it kind of covers up their teeth completely. So with this procedure, it kind of gives you a boost of your lip without actually having to put in any kind of filler. And it really can enhance your smile. And when you do smile, there's a little more tooth show. So it's really a wonderful procedure.
And then you were talking about, so the face, then let's move to the breast. So the breast area, what's kind of your...
Yeah, so I absolutely love breast reduction surgery. That's very life-changing for many women. It, alleviates all of this heaviness that they're carrying around on their chest. And that is really, really, like I said, one of the most highest patient satisfaction procedures I do. I love doing breast augmentations, breast lift with augmentation, removal of implants, replacement of implants plus a lift. There's so many variations of the procedure. What I'm seeing a lot now is an actual explant and reduction and lift. As we age, oftentimes women's breasts grow as they get older through menopause. And a lot of women that had an implant, 15, years ago, they don't need that volume at all anymore. And in fact, they need some reduction. So we can take out the implant, also take out some breast tissue, completely reconstruct that breast, and it looks amazing. And they, have a really good result, don't need an implant anymore. So basically, yeah, all of those procedures that involve, rejuvenating the breast on some level. And, it's an ongoing, continuum of women and breast changes. We all know that our breasts are very different from when we're 20 to when we're 40 to when we're 60. Uh-huh. And not only do the breasts change, we change sometimes too, and what our goals are, how we're feeling, so luckily there's a lot of, work to be done in that area, which I'm happy to participate in.
That's interesting to know that menopause, I guess it makes sense because the hormones affect so many things, that the breast can change after menopause.
Oh, absolutely. A lot of breasts grow a lot. As women get older. Yep.
Wow. Okay. As if menopause isn't enough, right? We get to have all these other little side
kinds of surprises.
Exactly. And then sort of moving down the body, I know a lot of people ask about, body lifts after maybe massive weight loss, or, what are some of the things that you...
That's a real area I absolutely love doing. When people lose a lot of weight, what they're usually left with is a lot of extra skin that they're not really anticipating. And that's where I come in to help them realize, why all that weight loss was good to do. Because sometimes they're heavy, but then they lose weight and the skin is more of a problem than they thought it would be. So a lower body lift can circumferentially, go around the patient and take off extra skin in the tummy area, back area. It can help lift the buttock. There's a thigh-plasty procedure that can actually take away excess skin in the thigh, skin and fat. And there's different techniques. One is called a vertical, which kind of goes all the way down the thigh. The other is a horizontal, which can stay hidden in the groin crease. So there's that. And even women that don't necessarily lose a lot of weight sometimes can benefit from that thigh-plasty. By doing some liposuction, decreasing the volume in that inner thigh and then tightening up the skin. That can be a very good option for that. The brachioplasty is a surgery that, takes care of that excess skin that's kind of on the arm that women, some women just gain a lot of weight in their arms. And once they lose it, they've got a tremendous amount of skin. A brachioplasty can help that a lot. And once again, even many women who don't have a massive weight loss can benefit from a brachioplasty. Everyone's skin is different. Some women's skin is much more loose, and that just really can bug some people a lot. And it's worth it for them to get that removed. There is a scar that has to mature over a period of time that can anywhere from a couple months to a year, but most people are willing to accept that in exchange for getting rid of the skin.
Yeah. I think it's like when I remember the first time I realized I was getting older was when I was at a USC game and I had my pom-poms and I'm shaking my pom-poms and I'm like, why is my arm shaking too? What's happening here?
What's going on?
This is not good. I need to get some weights going on or something.
It's a tough area.
Yeah, it is.
Tricep work can help, but it doesn't always take care of it completely.
Well, especially after any kind of major weight loss too. So, So let's talk a little bit about, what made you want to be a plastic surgeon?
Well, before we go into that, there's also tummy tucks that I absolutely love to do that we didn't really touch upon. And that's really, the bread and butter of plastic surgery. The mommy makeover per se is extremely popular. It is just one of the, surgeries I love to do. It basically the mommy makeover, as we all probably have figured out now, it's not necessarily an exact set of surgery. It can vary upon what the woman needs for the breast. Sometimes it's just a lift. Sometimes it's just an augmentation, but usually it's in conjunction with a tummy tuck. And why, obviously got that name is after we have babies, the tummy muscles stretch out and the skin can develop stretch marks and things like that. And the tummy tuck is a perfect a solution to that problem, a solution that many women struggle with. I can't tell you how many women come in and they say, well, my husband just said to work out more, lose more weight, and do more sit-ups. And that just is completely doesn't work. It helps. Obviously, we want to be in the best shape we can be in, obviously. However, with the structural changes that happen with pregnancy, that muscle is never going to actually go back to its structure. So, and some of the skin that's been stretched out is never going to go back either. So a lot of times, women need to be explained that, and they need to explain that to their husbands as well, is that, there's a certain, the wall that they're going to hit by just doing sit-ups. So sometimes that surgery is necessary to restore the body to what they, envision. And that can be combined with some liposuction, of course, in certain areas to, refine it or tighten things up. So liposuction is also used a lot along with that abdominoplasty procedure.
Yeah, I've seen, kind of everywhere, everything from sort of the mini, which is a mini. Do you ever, like a lot of us want to think, oh, I only need a mini.
Yeah.
But that's really for people who haven't had kids. Is that right? A mini?
Yeah. The mini is really very far and few in between are going to be appropriate for that. It's basically if a woman just has a little extra hanging skin right down at the level of her C-section scar per se, or for some other reason, but they don't really need any kind of muscle tightening. And, not every woman that's had a baby needs the muscle tightening. So there can be some candidates that, will really be good candidates for the mini, but most women will require the full tummy tuck.
A full tummy tuck. And you can do the standard or like an extended, like you were talking about, sort of to lift and take some of the hips away or the extra.
Exactly. It just depends on a woman's anatomy, how far that extra skin goes on the edges. Sometimes it goes further back. We can wrap it around if we need to. It's all extremely customizable.
That's nice.
And then one last procedure I definitely want to make sure we talk about is a labiaplasty.
Ah, okay.
So that is one of the, I think, even more popular high patient satisfaction procedures. It's become a lot more popular probably in the last decade. And that is, I think, related to women. We do more things now. There's different hair removal procedures and things like that. So we're kind of more aware of what our anatomy looks like. And every time I see the anatomy is normal. Okay. There's no abnormality. However, a lot of women just are bothered by some of the times when their labia, most specifically the labia minora, which are the inner lips, those sometimes they're all very different in how their structure is, how long they are, and there's just sometimes it's bothersome to patients when they work out or when they go to the bathroom or they're trying to wear a bathing suit. It's annoying to them. And it's a procedure that is relatively fast. It's relatively easy to recover from. And it really is life-changing for many, many women. And I see more and more younger gals wanting this, and they are just thrilled. So that's a really great procedure. I highly recommend to anyone who feels self-conscious or don't like that, area. And even though it's obviously not something everyone can see, it is something that changes a woman's just feeling about her entire body and self. It just helps her self-esteem. Mm-hmm. So that's a great procedure.
I think it comes from helping you feel better or more confident, but also if you have extra skin in that area, it can get in the way.
It does. Yeah.
And
it definitely can.
Take out a little extra skin. It's no longer getting in the way. It's no longer something you're even having to think about. So I love the fact that you brought that up. And for anybody in the audience who is interested, we do have a lot of information on our website about labiaplasty, and we also have a podcast on the lady bits because there are things you can do for surgery for the lady bits and non-surgery. So I think that's something that I'm kind of glad that social media is around for people to talk about it and normalize it, and
absolutely,
because it really can be life-changing. So
it can, yeah. And there's a lot of, it's kind of embarrassing. So it's nice to, I think, meet with a woman too. I think that's helpful. There's so many gals, they're so self-conscious, but once they, have the appointment, they feel so much better, and I can really help people feel at ease.
Yeah. Okay. So now my question is, what made you want to be a plastic surgeon, and kind of at what point in your training did you say, this is the avenue I want to take?
Yeah. So as a young girl, I always wanted to be a doctor. I knew I loved medicine. I was intrigued by all things medical. I loved being in hospitals. It was intriguing to me. So I set out on that path. I initially thought maybe dermatology because I was very interested in skin. And as I went through medical school, I just loved being in the operating room. So quickly, surgery became absolutely, I want to be a surgeon of some sort. And I enjoyed a lot of the surgical subspecialties. But I really was drawn to plastics, in my rotations when I started working with some of the plastic surgeons, and I really saw the variety of procedures they were doing. It's a field where there's just, as I've touched upon, I do many different things. And that really is exciting to be able to help people on so many different levels. So yeah, once I started doing those rotations and worked with some of the plastic surgeons, I really enjoyed the surgical variety and also the patient population. It's a little more luxurious, if you will, doing elective surgery. Trauma surgery is very stressful and very scary and very sad. I'm not someone who likes sad. So I really kind of, was driven more towards the happy in that, trying to make people happy. And, thank God for the people that are able to handle the really, really, traumatic, hard stuff. But I definitely, my personality is more suited towards, creating positive changes for people.
Now, how do you think about aging?
I think that our society is very, there's a lot of ageism. I think it's hard for people to get old. I think as a society, we don't really, women are kind of, I think, conditioned to, we have to keep looking good. So it's kind of the way it is, but I think it's okay. I think that as women, we do want to look good. I don't think there's anything wrong with wanting to look and feel good. So I'm just a proponent of self-care and letting women decide whatever they want to do is okay. If they want a facelift, great, empowering. If they don't want a facelift, that's empowering too. So I just think everyone should do what makes them feel good. I don't think anyone should really have to answer to societal, pressures, but just do what's in their heart,
So do you have sort of any thoughts on let's say, preventing aging or reversing or slowing it?
Oh yeah. I mean, there's so many, the Botox and the fillers and the, micro needling and peels and creams. I think all that is great. I mean, I'm very much a fan of all kinds, anything preventative. Absolutely. I mean, wear sunscreen, moisturize your skin. All those treatments I think are very helpful, and not only helpful, they make us feel good. It's a way to show ourselves some care, and so, I'm a big fan of any kind of preventive measures to help us feel good.
Now, what have you learned over the years from listening to your patients?
Well, I think that patients want to be heard. Number one, they want to feel like someone's really listening to them. They want to feel like, wow, she gets me. That's kind of what I, over the years, really just sitting down with women, connecting with women. We're all different. We all have different motivations or drivers or issues or problems. And, I like to try to get to the core of that in a sense of, what is it she's looking for, whether it be, a larger breast augmentation or a tiny breast augmentation or a little bit of a change in the face, or, I'd really like this to be like even more accentuated. Women just want to be understood. I don't think they want to be, put into a box and be told what needs to happen. In a way, I think that they do want to be heard. And the other thing that I find, I know that, we all want, kind of what do you think I should get? Right. And that's certainly true. People want my professional opinion, but on the other hand, people don't really want to be told, unsolicited that you need this and you need that and you should do this and that. I can't tell you how many people I've seen that other doctors have given them this long laundry list of things, and they're so turned off because they weren't looking for some of those things. So, I think it's, what I've learned, at least in my style, my approach, is that I really want to hear the woman. I want to figure out what's driving her. I want to figure out what's really bothering her. I want to let her know, what I think would really help her. I mean, obviously I suggest things if I think it's necessary. Yeah, well, to achieve that, I think we could do some fat transferring. Or, have you ever considered the lower eyelid while we're doing that upper? Just think about it, in a way that, like, I know you didn't come in here asking about that, but if you're going to go through this, I want you to pay attention to how much does it bother you at all? And if it does, think about it, because you're going to be having surgery, and that's a good time to do some things.
Yeah, I think, it's like when you go to the hairdresser, you're like, I want this, this, and this. But, sometimes they'll say, well, have you ever thought about, doing something different? And it's like, okay, I think sometimes I tend to leave it to the experts. Like, I think I know what I want, but I want your professional advice to say, what's going to really, like you said, achieve your goal? What's your goal? And then I can help you get there.
Yeah.
So what would you like patients to know about you?
Well, I would like them to know that if they come and see me, I will absolutely, really take great care of them. I will listen to them. I will, genuinely want to help them achieve their goal. I'll be with them, every step of the way. I think that's a real important, factor is that, you see a doctor and you have your surgery, but that's not the end of it necessarily. There's a lot of aftercare that, I do like to participate in, because it's a process, it's a journey, it's got its ups and downs. Okay. And yeah, you go through a couple days of feeling great, and then you're kind of feeling like, what did I do? And then you're, so there's a whole emotional journey that goes along with plastic surgery that, I like the patients to know that I'll be with them through it all. That's really the main message. And that, surgery is not perfect by any means. Everyone has to have a realistic approach. Surgery can always have little setbacks, small, minor things. But in the right hands, in the right care, with the right communication, none of that's going to be a problem. I would say all of my patients have access to my cell phone because I trust them, and I trust they're not going to bother me too much. They're not going to, and so that's a real comfort. And I love it when people text me, "Hey, this looks a little weird. What do you think?" And I can tell them immediately what to do. And that's very comforting. I think many of the, fears or issues is when a patient feels like they don't know where to turn or they're alone, and they've not gone through this process before. They don't know what's normal and what's not, and healing's a big thing. So that's my main message is I'm going to do amazing surgery. I will listen to my patients, but I'm also going to be with them, through it all and be available to them to get them through it. Because, like I said, it can have tiny little things that, that the patient doesn't know is normal, little tiny things. And I think with good communication, you wind up with a very happy patient.
Yeah. And that's so true. I think we all heal at completely different rates, and what your friend went through and what you're going through, it doesn't even matter what your friend went through because your body's going to do what your body's going to do. And having, don't go to Google about it. Go to your team and let them help you through that little hiccup, or maybe it's not even odd at all, So I think, having that two-way communication and them feeling like, I can ask her a question, even though it's a Saturday afternoon.
Absolutely.
You'd rather that than
absolutely. It takes 3 minutes to respond to something and let someone feel comfortable, than have them have to worry all weekend or something like that.
Right. So if we go now, we're going to skip into a little bit about you. So I'm going to ask a couple of questions. Tell me the best piece of advice you've ever been given.
That's interesting. I don't know. I don't know the best piece of advice. I know that somehow I've always had a pretty strong work ethic myself. Where I got that, probably my parents, but I have always been pretty focused, very driven, and I think that that's what's helped me get to where I am. And, I have 3 kids, and if any kids or people, ask advice, they're deciding what they want to do with their lives and things like that. I mean, my biggest advice to people, and because I've, lived this myself, is just don't be afraid if something takes a long time to get there, meaning, medical school, don't let that scare you if that's what you really want to do, So I think perseverance is really the message I was given. And that's probably the message I would relay to younger people, figuring out what they want in their life is don't let years of schooling deter you if that's what it takes to get there, because it'll be worth it in the end if that's what you want.
I love that, because I think especially in this society where technology is so dominant and everything happens so quickly that, back when I was a kid in school, after school, you go home and warm something up for after your snack. I mean, microwaves were brand new and you would use the stove, and it took time. And now everybody's like, they want whatever it is like yesterday. So it's true, like that perseverance, that message of, it's not always going to happen tomorrow, but it's worth it. If it's worth getting, it's worth putting in the work.
It takes time. A lot of things take time.
You're pretty into sports and physical activity. We talked about that. So do you have any adventurous activities that you want to try? Is there anything you haven't done that might be on that list?
I think what I would love to do is do like a cross-country skiing journey. I love like aerobic exercise, and skiing's just so amazing. So that's one thing I have definitely on my list, is maybe some nice cross-country skiing. I've never really done like, any kind of whitewater rafting. That seems kind of fun and exciting, although I don't really like the cold water. Other than that, there's no skydiving in my future. I can tell you that for sure. That just seems great. No bungee jumping or skydiving. So that's off the list. I'm a little bit risk averse when it comes to those things, but, yeah, sporty outdoor things sound pretty intriguing to me.
Okay. Last question. If you could teach a class on any subject, what would it be?
That's a good question. Well, I think that, what I feel that I am actually good at is patient communication. I do feel like I'm very effective in, reaching the patient, communicating with them. So, that could be something I think I could, help younger people, how to really effectively communicate with people. That would be something that I think could be interesting to share and teach.
Okay. I lied. One last question.
Okay. One more.
It's like, those photographers at a wedding. They'll one more picture, one more picture. Yeah, no.
Wait, turn around.
So at La Jolla Cosmetic, our brand promise is really, it's where dreams become real. We help you get to that dream and achieve that dream. So tell us, Dr. Breister, about a dream of yours that became real.
Well, let's see. That's a good question. I mean, as a young child, I somehow always knew I really wanted children. I would say that, being blessed with 3 amazing children is basically, a dream come true for me. And the fact that they're all thriving and healthy and thank God doing well is basically, the most I can ask for in this world, so. That would probably be my biggest dream come true, is just being able to share, life with 3 wonderful kids.
Nice. That's nice. And are they all close by, or?
They're all in California. Yep. They're all in, along the California coast. So I'm
not
lucky,
too far.
Blessed. Yeah. Not too far. Not too far.
Yeah. It's nice when, that you can see them on
a whim.
On a whim. Yeah, exactly. Yeah. It's a quick Southwest flight to go find them or have them come to you. So that's nice. Well, thank you for your time today. It was really lovely to talk to you. And let's dive into some of those procedures.
Okay.
I would love to really, go a little deeper into some of these things we talked about, the labiaplasty, the thigh-plasty, some of the body lifting that you do, and really what does that entail and who are the right candidates. So let's pencil in another Friday, maybe.
Sounds great. Sounds great. Thank you for having me.
Thank you for coming.
Take a screenshot of this podcast episode with your phone and show it at your consultation or appointment, or mention the promo code podcast to receive $25 off any service or product of $50 or more at La Jolla Cosmetic. La Jolla Cosmetic is located just off the I-5 San Diego freeway in the Zymed building on the Scripps Memorial Hospital campus. To learn more, go to ljcsc.com or follow the team on Instagram at ljcsc. The La Jolla Cosmetic Podcast is a production of The Axis, TheAxis.io.